Hey there, it's Dr. Tom with EBM Fitness Solutions, and I want to talk to you today about knee pain when lunging. We're going to go over some different ideas about which knee do you feel it in, the back knee versus the front knee, some of the causes, and give you a bunch of different options and ideas and different strategies that you can use to help learn how to lunge better so that you can get yourself out of pain. Lunges are not inherently bad for your knees. When they're done incorrectly, they can definitely contribute to knee pain. So we're going to go over a bunch of different things today to talk about how to get you out of pain and back to lunging with better technique. So you're setting up to do some lunges, and when you step back, you feel pain in that back leg. What do you do? What's going on? So here's what typically happens when you feel lunging in the back knee. You step back this way, and then what happens is the torso, people end up lunging like this with their torso vertical, and as you move to that vertical position, some people actually will kind of go even beyond that and kind of extend back. That puts a crazy amount of pressure on the back leg. Now, the problem with that is lunging should always be about your front leg. The back leg is there for balance only, a little bit of support. It is not the main driving force for your lunge. That's the first problem. Second, in this position, when I start to bend, that bent knee position is stretching your thigh, the quad muscle. And then what you're asking it to do is you're pushing off of it. So now you're taking a muscle that's got a nice, good stretch through it, and you're asking it to forcefully contract. Now, that'll be okay for some people. For most people, that's going to cause some discomfort in the knee. So the first thing we need to work on is getting the weight off the back foot. Remember, lunging should always be about your front leg and not your back leg. So if you're feeling pain in the back knee, the first thing you gotta do is check your torso position and work on getting your weight off the back leg and onto the front leg. Let's say you're lunging and you step back, but this time you feel pain in the front knee, not the back knee. What does that mean? What are some of the causes of that? Well, interestingly enough, the same thing that can cause pain in the back knee can actually cause pain in the front knee. And that's because you want this front knee to kind of be over the foot, right? The knees can move towards the toes. You want to keep your heel flat in the ground, but the more I do this, to see how my knee is falling back further behind where my ankle joint is, well, that puts the knee in a very awkward, a bit of a compromised position. So sometimes having too much pressure here, if it's not causing pain in the back knee, it could cause pain in the front knee. Or if you're wicked lucky, you could have pain in both knees when you lunge because of your position. Now the good news is you fix the position and the pain should go away. So one of the first things we would look at with front knee pain also is the same thing we look at with the back knee, and that sort of torso position and how much pressure you have on your back foot. Front knee pain when lunging can also be from a poor ability to hinge at the hips, which kind of piggybacks off the thing we just talked about. When you're leaning too far back, you are not hinging through the hips appropriately. So what we really want to do is initiate your motion through the hips, through the glutes. Glutes are also known as your butt muscles. So that instead of being this way, I want to be this way. So again, now I've got no pressure on this back leg. My weight is here, but I'm going through my hips and my glutes. Your glutes, they're strong. They need to be trained a lot. They need to be the focus of a lot of lower body movements. But for a lot of people, not only are they not used properly, but people have a hard time feeling and sort of, we'll say the word activating, kind of turning them on and getting them to kind of work. People have a hard time doing that. So that is something that needs to be addressed when you look at front knee pain with lunging, is getting better at hinging through the hips and using your glutes. Now, another thing that can contribute to knee pain in the front leg kind of ties into, again, what we just talked about. These things all kind of, they're all connected in a way. So when the glutes are not working properly and you're not moving through the hips properly, the hip doesn't stabilize properly, and then that actually creates an issue at the knee. So a lot of times when you're having knee issues and that when the pain comes out of nowhere, right? It's not as if you stepped down funny and you twisted your knee. It's one of those things where you're like, I don't know what I did, it came out of nowhere, right? A lot of times with knee pain, it actually comes from your hip, and this would be a perfect example of how that happens. So when you're not using the hip and the glute correctly, when you start to go through your motion, regardless of whether you're too far back or even if you're in the right position this way, the knee starts to collapse inward, okay? That's known as knee valgus. It's a sort of a knee position that actually is, it's not a knee motion though. So it's a position of the joint, but your knee can't do that, okay? Your knee basically, it bends and it straightens. It's a hinge. So if you see yourself doing this kind of a thing in the mirror, know that that is not a knee motion. It can hurt your knee. It puts a lot of stress in the knee joint, but that comes from either hip weakness and or ankle tightness. So it has nothing to do with the knee, but your knee can hurt. So this is why lunging sometimes can cause the lack of stability here causes pain down here. So you really have to make sure you have good stability here to control what's going on down there. So you've got some knee pain when lunging. What are some of the things you can do to get yourself out of pain and get back to being able to lunge and do other single leg movements like that? So the first thing that you want to look at is actually, it's the easiest entry point. It's one of the easiest things you can do, but it's also probably one of the most uncomfortable things, and it's foam rolling your IT band. Now, if you, prior to this video, didn't know you even had an IT band, then you are in for such a special treat. So the IT band is not really a muscle, it's a tendon. It runs from basically your hip down to your kneecap and then to the top part of your tibia, the lower leg bone, your shin bone, basically. So the problem that it can cause is because it has multiple attachment points, when it gets tight, it can pull on things. So it pulls here, it pulls on your kneecap. So it can be a source of knee pain. Because what it does is it interferes with how your kneecap moves, okay? So when you bend and straighten your knee, your kneecap actually moves up and down a little bit. That's a normal movement. But what happens is the IT band, because it attaches to your kneecap, it can pull to the side as it's trying to slide up and down. That can create some problems with how it tracks, and it can directly cause pain and indirectly cause pain in other parts of the knee. So what you need to do is you need to foam roll it or find somebody to get some pressure on it, because here's the deal. You really can't stretch your IT band, okay? You can try and you can twist and turn and do these different things, but the stretching for the IT band, they're pretty poor. And here's the thing, and I've written about this before, about stop stretching your tight muscles, because sometimes a tight muscle is not tight for the reason you think. It can be tight actually because it's overstretched and lengthened too much, right? So then if that's the case, stretching it actually makes things worse. So for the IT band, if people have a problem with it, it's not the kind of problem you're gonna resolve by stretching. So you need to get out a foam roller, you need to get out a rolling pin or some kind of a handheld massage device, whatever you have, and you need to work on rolling from, basically the side of your leg. Do not roll directly over the side of your knee, because you're getting down to that point where it's simply bone and other sort of support structures. That's gonna hurt, but not the kind of hurt we're interested in. So stay just above the knee. You'll get up to a point, not quite, so you have the crest of your hip, the hip bone here, and a little bit below that, there's another bone. It's actually the top of your thigh bone, or part of the thigh bone. It's a little bump on the side here, right? So it's right about the height of my pocket in my pants here. Don't roll over that thing either, because that's the kind of pain that you're just gonna hurt something, but there's no benefit in doing that. Stay in between there and roll the leg out. Here's something that I always tell my clients, my patients, when we do soft tissue work and soft tissue work only. And that's what this would classify as. You're rolling your IT band, or you're rolling out your calf, or you're doing some kind of massage type work. The more it hurts, the more you have to do it, because the tissue is responding in an abnormal way. Okay, it's not supposed to be that sensitive, that sort of tender to pressure. If it is, that's abnormal and you have to work on it. Now, it's going to be uncomfortable. I'm not even gonna lie, like, oh, it's not that bad. It's pretty terrible, but you need to do it, because all the other things we're gonna talk about are going to be limited if this thing's all locked up, and it's going to influence movement. So you have to kind of get in front of it, and you have to do that as uncomfortable and as awful as it can be. Trust me, if you can be good 2 to 3 times a day for a minute or 2 each time, so it's brief. You're not spending 30 minutes doing it. It's 1 to 2 minutes, 2 to 3 times a day, every day for 7 to 10 days. If you can commit to doing that, you're gonna move yourself much further ahead than if you kind of sort of skirt around it. Just commit to it, do it, find a way, suck it up, get through it. It will get better, that much I can promise you. Another strategy that you can use for helping to get out of pain with lunging is to deload the movement. So deloading is great because it can give us information, so we can use it as an assessment to further diagnose what's going on with the knee, and then we can actually use it as the first way to start retraining the motion. So if you're not familiar, what does a deloaded lunge look like? Well, take a look here. This is what it's going to look like. And you can do deloaded lunges with a pulley, cable kind of system, or you can use some kind of a band if you have some big, heavy, resistance or strength bands. So it doesn't matter how you do it, but use some kind of a deload. Now what this does is if you have pain lunging and then you do the deload and your pain goes away, that tells us that your knee joint itself is probably fine, that you don't have any kind of joint issue, that your pain is probably more muscular and movement based. That's good news, okay? If the pain persists with the deload, then I would suggest meeting with somebody, get more evaluation, dig deeper, figure out what's going on. But if it goes away, ACE is let's move forward, use the deload. And then what it allows you to do is to go through as much range of motion as you can, and it allows you to do it in a pain-free way. That's huge. Then you start to retrain the motion, and this deloading idea will actually work well with the next two strategies we're going to talk about in terms of some of the other hip hinging, motor control ideas. So deloading is great to both assess the knee and then to start to retrain that motion. The third strategy you can use for getting out of knee pain when lunging is to really improve your hip hinging ability. Now, this is a very broad topic and could involve a lot of other things, but it's really important. Basically, for almost any lower body exercise you're doing, right? So anything for your legs where your feet are on the ground, and that's a lot of different things. And this applies to daily activities as well, not just exercise. You really do need to understand how to hinge at your hips. It saves your back, it saves your knees, it's kind of a big deal. So if you struggle with a hip hinge, spend time getting good at it. And you could spend time even with like bridging, right? So basically, laying down, bridging, something like that. Get good at that because the hip hinge there is very similar to what we're going to talk about with everything else, but you have to get good at hinging through your hips. If you can't, this stuff is always going to be difficult, but then your daily activities, climbing stairs, sitting and standing, and anything that requires you to have all your weight on one leg and to bend, you're going to struggle. So get good at your hip hinge. Now, how do you do that? Well, there's a lot to go over, but basically the things you want to think about with a lunge is your heel and your hip, okay? So if I'm standing here, my left leg's forward, I'm going to push through my heel and I'm going to initiate through my hip. And you see what that does to my torso is it brings me slightly forward, okay? So heel, hip, so if I start to move and my heel comes off the ground, no good. That means that means I stop moving through my hip. So what you'll find is that if you start to shift on your toe, you really don't, your spine will probably bend, your knee will bend, but your hip really stops contributing. So what I would encourage you to do is go slow and then push back to the hip and keep pushing your butt back as you lower down. It'll feel weird at first, but you really want to kind of exaggerate the hip motion. Now, what you have to watch out for is kind of what we talked about in the beginning was putting too much pressure on the back foot, right? So I'm not shifting my weight back. That's different. I'm hinging at my hip. When you hinge at the hip, it allows my spine position here and here to be exactly the same. My spine doesn't have to move, and that's another important part. If you're looking at low back pain and issues there, being able to keep a good sort of neutral or braced spine position. So focus on get your heel on the ground and just start to come back. Even if you start your lunge like that, just start through a small range of motion, get used to the hip hinge, and if you can find a small range of motion that doesn't hurt, that's a good place to start. Whether it's deloaded or regular, start there and then slowly add more depth and work on your hip hinge. And don't be afraid to hold on to something. Grab a foam roller, grab a chair if you're at home. If you're at a gym, go next to a bench. If you're at home, go next to the couch, next to your bed. It doesn't matter. Use something to give you a little bit of help as you're learning the movement. Then as you become more proficient, take away the support and then still try to maintain your technique. A fourth strategy that we want to talk about is what's called motor control. And this one ties back into helping to control what the knee is doing, right? So if the hip doesn't stabilize properly, the knee will collapse inward. That creates stress at the knee. Now here's the thing, you can be very strong and hinge at your hips really well and still have the knee valgus, or that knee collapsing in. So it is a separate thing that you need to address. It is tied into other things, but I've watched people, or have known people, who are very strong but still have that, they just don't control the knee with what they're doing. So it's a hard thing for them because they have to do some more remedial type movements to help build that control, even though they're very strong. So the two things are connected, but they have to be addressed. You know, even though they're a part of the same movement, you have to think about them differently, okay? So the key with motor control, usually you have to slow things down. When you go too quick, it's easy to kind of fall into old patterns. So chances are, if you've got this collapsing in, it's happening with a bunch of other things you do throughout the day, whether you realize it or not. Could be exercise, could be daily activities, but it's happening, okay? So what I would encourage you to do is use a small foam roller, or put something in front of the knee. Give some great immediate feedback about position, where if I come down and all of a sudden I see my knee diving in around the foam roller, I can fix that right away. One of the things I think is very helpful is to kind of pause in the bottom position. Yes, it makes it harder, but it gives you a chance to control the transition from the bottom back up, right? Because what happens is people come down and then all of a sudden, see, when I did that, my knee kind of did a little, it came in and it came back out, and it'll probably be something quick like that. But because I move so quickly, I had no chance to correct that. Now, if I come down slow and I see my knee doing this, I can take a second, reposition my feet, and then come back up. Don't just blitz through it, because every time you do it wrong, you reinforce the wrong movement pattern. And then that becomes normal, and then your body just does it automatically, which is what makes unlearning this thing so hard, is that you've probably been doing this or allowing the knee to collapse for a long time, you just didn't know it. So now we have to go through and unlearn that essentially, while establishing a better way of doing things. Use something for balance. You know, if I have the small roller for feedback about my knee and I want to hold that bottom position, then grab a foam roller. So now I can come down, I've got help here, I can spend time positioning my feet, moving things around. Okay, now I'm good, now I come back up. So give yourself the support you need in the beginning, and then as you get stronger and you have better control, ditch the foam roller. Or keep it close, just don't put your hand on it right away. Use it maybe later in the set, but in the beginning, when you're trying to get out of pain, when you're trying to learn the motion, give yourself the support you need so you can learn it properly, change how the body moves, change those movement patterns, and get yourself out of pain while lunging. So sometimes the way to get out of pain when lunging is actually not to lunge at all, which I know sounds like such a dumb thing to say, but let me explain what I mean. So lunging and split squats, those are terms that sometimes kind of get thrown together to mean the same thing. They're similar, but they're not the same, okay? When we talk about lunging, you're gonna basically be stepping back and stepping forward on each rep, right? Whether you alternate legs or do them all on the same side, doesn't matter. One of your legs is always gonna be stepping back each rep. That's a lunge. A split squat, you set up in the position, but your feet don't move. So from here, I would simply lower down and come back up, and that's it. So again, they're similar, but they're different. The act of stepping back and forward each time, the motor control, that sort of coordination, is greater than if you just set your feet and work going up and down. So sometimes in the beginning, you can use your split squats to help you learn how to lunge, because all the things we talked about, deloading, hip hinge, motor control, knee valgus, you can address all those things at the same time during the split squat. So sometimes it's getting people set up, and I can still put my foam roller here, I can put my foam roller here. So now I have feedback about what this knee is doing. I have a little bit of support if I need it, but I've simplified the movement. So if you really struggle with that stepping back part, where you really feel like you're having a hard time setting up each rep, don't for now. Just go to the split squat, get set up, work on your technique, weight on the front leg, dig the heel in, work on all those pieces. And again, as you get stronger, less support, and then eventually come back to the actual lunge and see how it's going. You can kind of check in periodically. If the split squats are going well, but you're still struggling with the lunge, stick with the split squats. Continue to work on all the little pieces. Make sure your transitions, right? So when you get to the bottom here, don't bounce quick. Come down, control it, keep everything tight, and then bring that forward to the lunge. As you work through the split squats, whether it's deloaded and then regular, and then maybe you do deloaded lunges and then regular lunges, keep that tension, control that transition. Really take the time to learn how to do them well, but give yourself the support you need. Don't make it harder than it already is.